Bentall procedure is done for ascending aortic disease in association with aortic wall disease requiring surgical treatment. A composite graft is used to replace the proximal ascending aorta and the aortic wall. It is a procedure requiring median sternotomy and cardiopulmonary bypass. Sometimes Bentall procedure is also done for proximal aortic dissection involving the aortic wall. As the aortic root is replaced, coronary arteries have to be re-implanted into the composite graft. In a modification of the procedure, a full thickness button of aorta surrounding the coronary ostium has been used for making it easier to implant the proximal end of the coronary arteries into openings made in the aortic vascular graft. Button technique is especially useful in the presence of a fragile aortic wall. It has also been shown to improve late survival. There is a trend towards wall-sparing aortic root replacement in case of proximal aortic aneurysm and dissection. In a study of 25 patients undergoing wall-sparing aortic root replacement, 8 had moderate aortic regurgitation while 6 had severe aortic regurgitation. The study documented acceptable morbidity and mortality with a comparable long-term survival in comparison with Bentall procedure. Concomitant coronary artery bypass grafting, excluding coronary reimplantation, was also performed in 8 patients in the wall-sparing group. Here are a few relevant journal references. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video. Kindly press the bell icon after that for getting all updates.